Recognizing the signs, common symptoms of COVID-19. COVID-19 symptoms typically appear 2 to 14 days after exposure. They can range from mild to severe, and not everyone experiences them the same way. Some people have no symptoms at all. However, it's important to be aware of the common signs. Fever is a hallmark symptom, often exceeding 100.4 degrees Fahrenheit or 38 degrees Celsius. A persistent dry cough is another frequent complaint. Many people experience fatigue, which can be quite debilitating. Muscle or body aches are also common, reflecting the body's inflammatory response. Other symptoms can include headache, sore throat, congestion, or a runny nose. These can resemble a common cold or flu. Loss of taste or smell, known as anosmia or ageusia, is a more distinctive symptom. This can occur early on, sometimes even without other respiratory issues. Some individuals may experience gastrointestinal symptoms like nausea, vomiting, or diarrhea. It's important to remember that symptom severity can vary widely. Factors like age, underlying health conditions, and even the specific variant of the virus can influence how the illness presents. If you experience any of these symptoms, especially if you've been in contact with someone who has tested positive for COVID-19, it's crucial to isolate yourself and get tested. Early detection is key to preventing further spread and seeking appropriate care if needed. When to worry: severe symptoms requiring immediate attention. While many people experience mild COVID-19 symptoms, some develop more severe complications. It's crucial to recognize these warning signs and seek immediate medical attention if they arise. Difficulty breathing or shortness of breath is a major red flag. This can indicate lung involvement, such as pneumonia or acute respiratory distress syndrome, also known as ARDS. Persistent chest pain or pressure is another alarming symptom that shouldn't be ignored. It could signal heart or lung problems that require urgent care. Confusion or an inability to stay awake can be a sign of oxygen deprivation or neurological complications. Bluish lips or face, known as cyanosis, is a medical emergency indicating severely low oxygen levels. If you or someone you're with experiences any of these severe symptoms, call emergency services immediately. Prompt medical intervention is essential for managing these complications and improving outcomes. Remember, early detection and treatment are crucial in the fight against COVID-19. Silent spreaders, asymptomatic cases, and their role in transmission. One of the trickiest aspects of COVID-19 is the potential for asymptomatic spread. This means individuals can carry and transmit the virus without displaying any symptoms themselves. While seemingly healthy, they can unknowingly infect others, making containment efforts more challenging. The prevalence of asymptomatic cases varies, but studies suggest a significant proportion of infections may be spread this way. This highlights the importance of widespread testing, even in the absence of symptoms. It also emphasizes the need for continued vigilance with preventive measures. Mask wearing, especially in crowded or indoor settings, remains crucial in reducing transmission risk from those who may be unaware they're carrying the virus. Regular hand washing and physical distancing also play vital roles in curbing silent spread. By adopting these precautions, we can help protect ourselves and others, particularly those who are more vulnerable to severe illness. Awareness of asymptomatic transmission is crucial in our ongoing efforts to control the pandemic. The long-haul understanding long COVID and its lingering effects. While most people recover fully from COVID-19 within a few weeks, some experience lingering symptoms for months after the initial infection. This condition, known as long COVID or post-acute sequelae of SARS-CoV-2 infection, often referred to as PASI, can affect various organ systems. Common long COVID symptoms include persistent fatigue, brain fog, which is difficulty concentrating, shortness of breath, chest pain, and joint or muscle pain. Some individuals experience neurological issues like memory problems, sleep disturbances, depression, and anxiety. Others develop cardiovascular symptoms such as palpitations or postural orthostatic tachycardia syndrome, known as POTS, which causes a rapid heart rate upon standing. The exact mechanisms underlying long COVID are still being investigated, but it's believed to involve a combination of factors, including persistent inflammation, autoimmune responses, and damage to various organs. Managing long COVID often requires a multidisciplinary approach, addressing the specific symptoms and their impact on an individual's life. If you experience persistent symptoms after recovering from COVID-19, it's crucial to consult your healthcare provider for proper evaluation and management. Research on long COVID is ongoing, and understanding its long-term implications remains a public health priority.